What's up, y'all? My name's Drew. I'm one of the rising Ophtho first years, coming at you here from the VA call room. As you can tell, it's a super busy night, so I've had some time just to kind of explain a little bit about the plastic surgery rotation. It's a pretty interesting one. You get to do a lot of suturing and spend a lot of time in the OR, which is great, and some applicable things for ophthalmology. So yeah, just a normal day with that rotation. You get there 6:45, 7 most mornings. You don't have to pre-round on patients, which is great. The fellows on the service are the ones that generally see the patients first, and they make the plan. So basically, it's your job just to get there, learn about the patients a little bit once you get there, and then listen to the plan for the day. After that sort of morning circle, everybody heads off in their own direction. So generally, your responsibilities are following up on any dressing changes. You'll work closely with the NPs on the service, who are great. They're awesome. They're probably my favorite NPs that I worked with in the hospital this entire year. They know so much and they're super helpful. But after everybody breaks off and does their own thing, generally you'll be holding the floor pager and the consult pager, which sounds a little daunting, but it's actually a really good learning opportunity. It's probably the rotation where you become super efficient with the consults that you see. And the fellows on the service are super helpful in terms of staffing those consults and, teaching you things you need to know, and then letting you do things that you should be able to do, like suturing and all that whatnot. So most of the consults will come down in the ED, and it's not super heavy. Sometimes you're on what's called triple call, and that means that you're covering face, hand, and plastic surgery, which can get a little hectic at times, but you always have a buddy from some of the upper levels on the service that help you out, which is great. And like I said, you get to do a lot of procedures, a lot of suturing around the face, hands, sort of all over the body. And yeah, you just get a lot of really great practice sort of running around the hospital and seeing people. But you also get to spend a lot of time during the day in the operating room, which is great. You do a lot of skin grafts and sort of the lower level procedures like that. You get to work with Dr. Thayer and some other really interesting plastic surgery attendings who let you suture. You'll be stapling on skin grafts. And then you do a lot of learning in terms of what like normal pre-op and post-op orders would be, which again is super useful for moving forward in ophthalmology. Overall, super interesting rotation. It's a little tough to kind of get used to the workflow, but once you get into it, you really learn how to be efficient. You get to know the fellows who are awesome. They're super great, very helpful. And you also get to practice a lot of your surgical skills, which is great. So overall, interesting rotation, really enjoyed it. The intern year for general surgery, it sounds super daunting, and it scares people, I would say. And I was a little intimidated learning that I would be seeing vascular surgery patients and people that appear sicker. But really, at the end of the day, there's always support. There's always somebody in the hospital that helps you. There's always somebody who's a phone call away, and so you're never stranded. You never feel stranded. And plus, the people in the general surgery department here at Vanderbilt are actually awesome. I haven't been yelled at by any attendings. Everyone is always super willing to teach and is super willing to help you out. Like I've honestly never felt stranded. I've never felt alone. And you don't have to spend so much time rounding like you would on if you're doing a medicine intern year. Like we round, if you're rounding on a service, you're done by 8 or 9 at the absolute latest. And then you spend the rest of the day, practicing surgery skills, practicing your consult efficiency. Just in general, you're up and doing things, so it feels more active. And even though you're working quite a bit, the day goes by super fast, and the weeks, it feels like I just started last week, but I'm about to finish my first year, which is actually awesome. So yeah, overall the year has been great. I'm really glad that I did surgery instead of medicine, and I think specifically the Vanderbilt General Surgery Department has been really incredible to work with, and I'm glad that I've gotten to know so many people, especially because we work a lot with prelim general surgery people who are going into other things, right? So got to meet the urology folks, got to meet the ortho folks, got to meet the ENT, anesthesia, a bunch of these other people that we're going to be seeing in the hospital and working pretty closely with. So it's great to start creating a support system among all these people outside of ophthalmology. So if I'm tired of talking about eyeballs, I can go hang out with my general surgery friends or my anesthesia friends and talk about things and just decompress and get away from it all, which is I think will be a really great thing moving forward. So, overall, really been a great year. Glad that I've been through it, but I'm also glad to be on the other side.